As a doctor, I get asked this question, and I wish I can give you a simple, straight 10-second answer to this. Whether am I just forgetful, or is it something more serious that I need to talk to my doctor and then take it further? As I say, the answer is not straightforward as you and I would hope so, because there are other factors contributing to so-called forgetfulness. It could be just as a function of aging, or it could be one of the commonest factors that could lead to forgetfulness in aging population is the hearing. The other important factors is attentional deficit, and there are many causes of that as well. So therefore, is it forgetfulness or is it something sinister? In my practice, in my experience as a dementia specialist, I use a rule of thumb that if the forgetfulness is recurrent, it's repetitive, it's getting severe, and it does not help with people providing with cues, then it is probably more than just forgetfulness. That's the red flag, or I call the alarm bells, starting to ring. Is dementia the beginning of the end? How should we approach these very difficult questions? I would like to rephrase that question. Dementia is the beginning of a change, not of the end. Think about it. We all pass on sometime. We don't know when, we don't know how, we don't know what sort of illness we're going to have as we grow older. So we are all, in fact, you and I, the audience, are in fact on the continuous life journey of the beginning of the end. So therefore, why would people with dementia be treated differently? So I like to really rephrase that question to dementia is the beginning of the change. Now, I'm not trying to sugarcoat it. It's not going to be easy. It's not going to be pretty. It's going to be hard for people, the sufferer, the patient, and in particularly the carers. I'm not trying to sugarcoat it. It is what it is. But we really need to know that this diagnosis is beginning of a series of change. And the fundamental things that I like all of us to bear in mind is that Uncle Billy and Auntie Grace is still Uncle Billy and Auntie Grace. We really need to look beyond the changes and to accept who they are and to help them to live the rest of their life. Assuming the diagnosis is made, and pay attention to the word assuming, because the diagnosis has to be made according to strict criteria. And one of the negative things that I find about this diagnosis is that we use this term too loosely. And I don't like to use this term because it is like giving people a life sentence. It is not what it is, as I mentioned before. So follow on the conversation from before. What do I do next? Assuming the diagnosis has been made firmly, and there's no doubt about that. I encourage the family to find out more, the facts about this condition. Try to talk to a real person. I discourage Dr. Google because Dr. Google cannot give you a right information and cannot put things in the right perspective. Join the forum, focus group, which Prime Aged Care is very keen to conduct at Prime Garden, Mont Albert North. We are the real person that have the real passion to advocate for the socially disadvantaged, including those with cognitively impaired person. Talk to people, an association like DFM, Don't Forget Me. because these organizations are real people. They are passionate in helping the carers to care for your loved one at home by providing therapies and tools to help with that.